Hello, I'm Asia. I'm a level 1 nursing student. Can I get Aspart on your patient?
Sure. We're going to be seeing Marta Yarn. She's 80 years old, a female. She's 175 pounds. She's 5'5". She has no known allergies. Dr. Jolly is her doctor. She's in room 529. She is a full coat. She's here for a non-healing sacral ulcer that she's had for 3 months. It's now a stage 3 with serous exudate. She's got poor skin turgor. She's Q4 vital. She's up with a cyst. She's on a regular diet until midnight tonight. Then she's NPO because she's going for surgical debridement tomorrow. We have ordered for her CVC with DIF, CMP, and INR, PT, PTT, and urinalysis. Those results came back, and her sodium's 145, which is kind of a little bit high, or on the cusp of being high. She also had a white blood cell count of 12,500, so that's elevated, showing that she is having some infection. Her urinalysis was negative for growth. We need to order a nutritionist to come see her and a wound specialist. She has been admitted multiple times for dehydration and pneumonia, so we want to watch her for that as well. She is a widow and she is residing in senior housing. She has 2 children, but they live very far away. On her check, she had no headaches, no change of vision. She is a fall risk though, because she has some lower back pain and she is using a walker.
Okay.
Her lung sounds were symmetric and clear. She's not a smoker. She did have anterior and posterior diminished in the bases, though, of her lungs.
Okay.
Her heart sounds were normal sinus rhythm. She does have some premature beats. She has no edema. She does have some poor appetite, no nausea, no vomiting, or any difficulties going to the bathroom. Her abdomen's soft, non-tender. She is slightly obese. Her bowel sounds are present in all 4 quadrants. She does have occasional stress incontinence with nocturia. Her last vitals were taken at 2:15. Her respirations were 24, pulse was 88, O2 was at 92, and her blood pressure was 144/90. We are recording her intake and output. And she does have a right dorsal peripheral IV set up. She's on a couple meds. The ones that we're going to be setting up today, IV, is normal saline with potassium chloride. And we're also going to give her gentamicin because she does have that high white blood cell count infection. And she is on PRN, morphine sulfate injection. And do you have any questions?
Yes, I have some questions about the drug. Why specifically is the client receiving this medication, and what action does the medication have on the body?
Okay, she's receiving the normal saline to keep her hydrated with the potassium, keep her levels up because she is 80 years old and she does have recurrence of dehydration.
Okay.
And that pneumonia, the gentamicin we're giving because she does have an infection, that sacral non-healing ulcer. That's probably what's infected. So we're going to give her that gentamicin to help cure that and help her body heal.
Okay. When should you question administering this medication?
We should question administering this if the patient have like any allergies to this medication, the gentamicin, and if they've had any reactions to the medication in that family.
Okay. Does the medication have a therapeutic serum level?
It does. It has a reference range. For the optimal reference range is 5 to 10 micrograms per milliliter, and then it has toxic anything above 12 micrograms per milliliter.
Okay. Which vital signs must be monitored?
We want to monitor all her regular vital signs. We are giving her fluids, so we want to keep an eye on her blood pressure and her respiration rates. Since it is an antibiotic that we're giving her, we want to make sure she doesn't have a reaction, so we're going to be watching that and her lab values. And also, probably gonna the doctor will probably reorder that white blood cell count, see if it's working.
Which physiological parameters should be monitored when the medication is being administered?
We want to make sure the patient doesn't have any like difficulty breathing that could make a sign that she is having an allergic reaction. Any hives or swelling, itching, ringing of the ears, weakness, anything like that.
What interventions must be taught to the client to ensure the medication is administered safely in a hospital setting?
We want to make sure that the patient knows the signs and symptoms of an allergic reaction to this medication. That way they can make us aware if they're feeling any of those, and we can stop the medication immediately.
What interventions must be taught for taking the medication safely at home?
Normally they wouldn't be taking this medication at home. We want to try and make sure that's monitored in the facility or at a closely watched outpatient setting, maybe a rehab or something like that. This is an IV medication, so we would normally do it in the hospital setting.
What are the side effects and potential adverse reactions?
Side effects, I would say, and adverse reactions would be an allergic reaction, so any anaphylaxis type behavior, swelling, shortness of breath, tightness, itching, hives.
How will you know the medication is effective?
We'll retest those white blood cell count again, and it should be decreasing as the body is receiving that medication, the gentamicin.
Okay. Can I watch you give meds?
Okay. Knock, knock.
Hello.
Hello, Miss Yarn.
Oh, hi.
My name is Melody. I'm your nurse today, and I have a nursing student with me. Her name is Asia.
Hi, Miss Yarn. I'm just going to be watching.
Yes.
Okay, sweetie.
And what's your date and name and date of birth?
My name is Miss Marta Yarns, 1/1/36. I'm 80 years old.
Okay, do you have any allergies?
I do not have any allergies.
Okay. So I'm just gonna check her chart and make sure that she doesn't have any allergies on the chart.
Okay.
But she doesn't. So that's accurate. And Miss Yarn, we're going to be giving you some medication today along with some normal saline that's going to keep you hydrated with the potassium, okay?
Okay.
And that medication that the doctor ordered is gentamicin, and that's to help you. Looks like your white blood cell count came up a little elevated, so probably due to that infection that you have in that sacral area where the ulcer is. So that medication is going to help kill the bacteria and inhibit that bacteria growth in that area, okay?
Oh, thank you.
All right. Are you okay with us giving you these medications today?
Yes, please.
Okay. So I have the medications here. Go ahead and scan your armband. Oops. Not rip it off. I'm gonna have to do that again. And first we're going to hang the normal saline with the potassium chloride. So we're going to check and make sure that it's clear, it's not cloudy, the bag doesn't look damaged, the expiration date's on there, and it is a good expiration date. The bag also matches the doctor's order in here,
Okay.
so that's fine. So the tip of this is sterile, so when we take off the cap and we get the bag in there, we want to make sure that we keep that area sterile. And I'm actually going to stake it down here, it's a little bit easier. So this goes into the machine. Close this up. Turn this on. I'm just setting up the pump here.
Okay.
So the rate that the doctor had ordered for this sodium chloride is 125 milliliters over an hour. So we're going to go ahead and we're going to check the patient's IV site, and it looks normal, doesn't look puffy, doesn't look red or anything like that, so that's good. And we're going to just go ahead and flush it to make sure that it's still intact and in the vein. So I'm going to first alcohol swab the area, and we're going to hook up this flush. Make sure that we don't have any resistance. And it looks like it flushed normally, so that's good. Okay. We're gonna now hook up alcohol swab. This port is sterile.
Okay.
Okay, so we're gonna hook this up to their IV. We're gonna unclamp and then start our
Pretty much all set, yeah. Are you wanna get another one? We're at 4.
okay, and then that should be flowing there. And then we're gonna hang our other one, which is the gentamicin.
You guys have your label with stuff and stuff, so I'll tell you it's like a Foley.
So we're gonna go ahead and scan that, make sure it matches. I'm gonna spike it here. It's a little bit easier to do it that way. And we're gonna hang this, our primary one, a little bit lower than the actual antibiotic here.
No, I'm done, but that computer wasn't working for us, so we hooked up our own
So
computer.
once this is spiked, we're gonna hook it up to this hub here, which we wanna get the closest one to the machine. That way the machine, and you're alcohol swabbing this area. I'm gonna select gentamicin on here. Right here. We're gonna make sure that that matches up to the order, which it does. Okay. Make sure that you unclamp these, and it should be ready to go.
You gotta pick one.
Oh, okay.
Oh, go back. Yeah, and then I think it's the second one. The second.
All right. So our order for the gentamicin. And the order is for 80 milligrams.
Go back. Go back.
Oh, here it is. Yeah, this is correct. Okay, 80 milligrams. And the ml. Okay. Alright, so that should be pumping. We're going to make sure we unclamp, and we're going to wait for the 5 drops. And the machine's asking you to verify that everything's unclamped, which it is.
Okay.
And it should be pumping in. And wait for the 5 drops here. Okay. So it'll also tell you on here what's going into the patient and what rate it is going in at.
Oh, great.
Okay. So, Miss Marta Yarn, I'm sorry. Do you know the side effects to this medication and what we're going to watch for?
Yes, being like hard of hearing or having a rash.
Yes. And any chest tightness, any dizziness,
Okay.
anything like that, we want to watch for and make sure that your call bell is near you, that you can call me if you need to, if you feel any of those symptoms, so we can stop the antibiotic right away.
Okay.
So you're going to also label your tubes to let the person know when they were done, when they were originally put on, and when they should be changed.
Okay.
Okay. Alrighty. Okay, so if you need anything, you just give me a call, okay?
Thank you so much. So I just had a couple more questions.
Sure.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, we want to make sure that all her vitals are good, and that it is appropriate to be giving her that antibiotic, that she's not allergic to it, which it is appropriate because her white blood cell count is too high.
Did this information affect your decision to administer the medication?
It did, in the sense that it's okay to give because all of those were clear.
Did it affect how you administered the medication?
No, I just administered it regularly because she was not allergic to it, and it was ordered, and it was accurately ordered.
All right, thanks, Melanie.
All right, thank you.